Spinal muscular atrophy is a progressive neurodegenerative disorder that affects compromised individuals at any age, or SMA for short. It is mostly seen in infants, but cases have also been seen in adulthood. It affects around 1 in 10,000 individuals every year. This sort of progressive disease is synonymous to saying that over time, it worsens and results in a decline in health or function. A key term to take note of is atrophy. This essentially means that as the disease progresses, muscles are not being used efficiently or at all. It will decrease significantly in size given its development has been arrested through a lack of movement. In the case of spinal muscular atrophy, overall motor function is severely compromised. Motor function encompasses everyday movements that are necessary for a good quality of life. For example, walking, jumping, even standing. For children, these motor skills are imperative to discern where they stand in their developmental stages. When these motor skills are not up to standard, they are not able to attain regular milestones, which can indicate the beginning of the SMA onset. This disease is caused by faulty or complete homozygous loss of the SMN1 encoding gene located on chromosome 5q13. It is responsible for the production of the survival motor neuron protein, or SMN, as a commonly used abbreviation. This protein is mostly present throughout the spinal cord and plays a large role in the maintenance of motor neuron health, which cumulatively works at keeping the overall body healthy. This disease follows an autosomal recessive inheritance pattern, meaning that individuals who know someone in the family with this error in the SMN1 encoding gene have a 25% chance of inheriting it. In other words, 2 copies of an abnormal gene must be present for the disease to happen. People are often carriers and have no clue of it until they have a child with symptoms that are associated with the development of SMA. This disease is detected through newborn screenings, as it was recently added to the Recommended Uniform Screening Panel, RUSP, clinical observations, muscle biopsies, to detect atrophy, molecular genetic testing, to see if there exists a faulty SMN1 gene, and more. Although symptoms amongst cases are extremely heterogeneous, it is important to note that these symptoms are what aid in deciphering type 1 spinal muscular atrophy from type 4. There exist 4 types of SMA which are dependent on time of onset, as well as the severity of the symptoms experienced. Type 1 comprises 60% of patients and is the most severe. Symptoms can appear as early as birth until 6 months of age. The most common symptoms within this subtype is hypotonia, another word for decreased muscle tone, or floppy-like limbs, difficulty breathing. Dysphagia refers to the inability to swallow properly, unable to sit or walk without assistance, etc. Unfortunately, children typically die before they achieve their second birthday. SMA type 2, also known as Dubowitz disease, covers approximately 30% of the cases. This is diagnosed between the age of 6 months to 18 months of age. Patients are still not usually able to walk and are wheelchair-bound. They do not achieve regular milestones, yet their life expectancy is longer than that of type 1. You may notice a pattern, which is that as the number corresponding to the type of SMA increases, the symptoms are less invasive as well as a more delayed diagnosis in life. SMA type 3 and 4 only account for 10% of cases. Type 3, also known as Kugelbert-Welander SMA, is diagnosed after the age of 18 months old and can be detectable even into adolescence. Patients are usually able to walk with physical therapy and it does not significantly impact life expectancy. Symptoms are more mild and can be muscle weakness, respiratory problems, balance issues, etc. Lastly, SMA type 4 is the most rare form. Most of these cases only develop in patients' 30s. Patients are usually able to maintain a fully mobile life, and will usually not experience respiratory problems. It is important to note that there also exists a type 0, which corresponds to the detection of the SMN1 gene during pregnancy, but diagnosis is usually done after birth through detection of any of these symptoms. Most infantile deaths that occur in relation to SMA complications are the result of respiratory issues due to the previously explained atrophy that occurs within the muscles, in this case, the respiratory tract muscles. Although the disease is extremely heavy, there is hope. A recent discovery of a one-time intravenous infusion labeled as Zolgensma is deemed as a very promising gene therapy. It essentially works by providing a new copy of the SMN1 gene in order to alleviate the insufficient production of the SMN protein. This was only established in 2019 and has been a monumental discovery for SMA, which shows that one should be optimistic. There is hope.